So, preparation. First step is to grind the tooth circumferentially and a little bit on top. So this is all review. And there's kind of three things we want to look at: biologic, mechanical, and aesthetic. So biology is, the tooth is sort of a living kind of organic substance. We got nerve and blood supply that runs through it. So we have a pulp. And around that tooth, there's also our periodontium. So our epithelial attachments, we got PDL, we got bone that surrounds it. So how does that play a role with when we put a crown on that tooth? Then we also talk about protecting against fracture. So we mentioned that last time as one of the reasons why we would need to do a crown is for the structural integrity of the tooth. Let me go back real quick. And we'll get into the other properties a little bit in the lecture where we talk about resisting removal forces and functional loads. And obviously we want the crown to hopefully look like a tooth, not only in shape, but nowadays with porcelain in color as well. Right. So getting into that first part, the biologic part, we talk about, and somebody had mentioned this or asked about it last week, was the pulp. So we can see that a crown prep is pretty invasive in the sense that you're removing a lot of tooth structure. And you got this burr flying around with this coarse diamond, and it's heating up as it's grinding. And we can see from here the pulp tends to recede as patients get older. So the time frame in which the patient receives a crown may play a role in sort of the biological outcome of this tooth. So if somebody's getting a crown prep at 19, right? Look at where their pulp horns are and think about your crown preparation and how close you are proximity-wise from the outside of that prep to the pulp. The idea is that whenever we touch a tooth, we're in some way traumatizing that pulp. It's a pulpal insult. When we do that enough times, then that pulp can eventually give out. So if we think about the kind of the, I don't know if it's a normal sequence, but a typical sequence in which a patient gets a crown, right? They initially start off with some sort of dental caries. Hopefully they catch it soon enough. Then we can do a direct restoration, right? So an occlusal or an MO or MOD, something like that. And we can get rid of the decay and then fill the tooth and restore the tooth. Well, oftentimes then there's some recurrent decay under there over some time. And then now you got to remove not only the old filling, but also the decay that is formed. And so each time you're grinding, you first do your restoration, then years later, then you start grinding the tooth down. We're always traumatizing this pulp. Another thing that happens too is when we grind, and this is why we always ask you to use water when you're prepping your tooth, it's because just the speed and the friction from the diamond burrs increases the pulpal temperature. So on the right you can see just a little chart. Groups 1 and 3 have water cooling in them. And you can see how the water helps prevent the pulpal temperature to reach this critical range where the tooth gets insulted. So what we typically see is that, if you prepped 100 teeth, let's say, for crowns, even if there's no cavity that spreads into the pulp, there's going to be a percentage of those teeth that just ends up needing endodontic treatment or a root canal, meaning you strip the nerve, just from the mere fact that you've spun this tooth down circumferentially. All right, so water cooling is important. Age is important. Those are the couple things that you got to remember. And also the type of preparation has a factor in terms of how much pulp will insult. So we know if we compare a metal crown versus a porcelain fused metal crown, right? The porcelain fused metal crown needs more reduction overall because you got to make space for the metal and porcelain. So if we remove more tooth, that gets us closer to the center, which is the pulp. All right, let's move on. So this is number 30, just a cross-sectional view, and there's a few aspects of this tooth that we want to kind of pay attention to, or that we'll reference to in terms of our measurements. So we'll run through this pretty quickly. So we have functional cusp, central groove, non-functional cusp, the axial wall, and the margin. So if you were to look through your handbook, we will reference these parts of the tooth in terms of giving you a measurement of how much reduction we want. So graphically, number 1, functional cusp. So in our mandibular tooth number 30 we're doing today, it's going to be on our facial cusp. The central groove, we want to have adequate reduction. And, sorry, the numbers are a little off. That should be number 2. So central groove is one of those areas that are almost always under-reduced. And probably because it's a little harder to gauge. But pay attention to that central groove. So the whole idea of this prep check software that we have is to be able to look at your prep in cross-section so we can kind of gauge what we've reduced as we kind of go along. So really want you guys to utilize that tool that we have for you. Then our non-functional cusp. Axial wall is how much we reduce as we go towards the tooth. And the margin is where the crown meets the tooth, that junction, how wide that should be. And for today's exercise, it's a little simple. Almost everything is 1.5 millimeters. So you'll see these numbers change depending on what type of tooth we do. So for our cusp reductions and our just everything on the occlusal, 1.5 millimeters. Okay. So of course we need a little bit more room for metal and porcelain. And then axially, we're going to go in 1.5 millimeters. Again, right, the porcelain fused metal crown, there's a metal substructure. So what's the problem with having metal if you want to put porcelain on it? It won't fuse. So why won't it fuse? Or can we get it to fuse? So if we put that metal in the oven, we can get an oxide layer, is what we call it. And then you can throw porcelain at it, or stack porcelain on it, and then put it in the oven and it'll fire or bake. And that actually forms a layer that does fuse. Okay. So what else is an issue with a metal ceramic crown versus an all ceramic crown? Right, so we want to have adequate reduction to make room for the metal and porcelain. Okay. What's another challenge that we have what's the challenge we have if we don't have enough reduction aside from a structural standpoint? Because you're saying, okay, if our porcelain is real thin, right, then it would potentially fracture. So other than the structural integrity of the porcelain, what's another concern? The tooth itself. Keep going with that.
How much structure is left?
Okay, so we run out of tooth structure where instead of a stump, we just get a little stick. What about hyperocclusion? Keep going with that.
If you under-reduced and the porcelain was made to its smallest and it goes on the tooth and it was under-reduced and the tooth high.
Okay, so we'd have to decrease the amount of porcelain there.
Right.
To make it in proper occlusion, and that gets back to what Tim was talking about, where the structural integrity. All right, let's think about, oh, go ahead.
Mechanical retention.
Mechanical retention, okay. So what do you mean by that?
You need adequate width on your prep for your crown to stick.
Need adequate, where do you need the width?
Margin.
At the margin, okay. Okay. So let's think about the steps in watching the video. All right, last one here. See the metal through, right? So remember when we showed the video where we had that metal coping? What was the first step that they did after they oxidized the layer, or the crown? You guys remember from the video? The opaque layer, right? So we got to turn something that's dark into something that's light so that when they stack the remaining porcelain, you're starting off with something that's white, and then it'll look more natural than if you just stuck straight translucent porcelain onto this metal substructure. So the idea is that we got to block out the metal that's underneath with an opaque layer of porcelain. Then we have our body porcelain, our enamel layer. So porcelains come in different kind of opacities, but you got to start off with an opaque layer before we kind of can make it look pretty. So all that being said, is the idea is that a porcelain-fused metal crown requires just more space for all the reasons that you guys had mentioned. I think the first that comes to mind is structure in terms of strength, but also color comes into play. All right, so facial margin, we want 1.2. And on the lingual, we're okay with a metal band, so we're okay with a 0.5 millimeter chamfer. And we'll get into that a little bit deeper. One feature I do want to point out, too, is this idea of a functional cusp bevel. So the idea is that the functional cusp is going to be the one that's under stress. So we take an extra step here, and we bevel it, and you want to have the direction or the orientation of the bevel to be pretty similar to the angle that that opposing cusp is at. So you want to take another plane of reduction here so that this thickness here is adequate. So you got buccal lingual kind of reduction, but also on your buccal, in the number 30 case, in the case of tooth number 30, you're going to do a functional cusp bevel reduction as well. All right, so let's briefly kind of go over this again. What shape should the margin look like? Two choices, shoulder and chamfer. We know that the chamfer forms an obtuse angle. Just think of it as it rounds out. So the chamfer is good for these reasons. One, it's more conservative, and I'll show you a picture comparing the two. But the idea is on the lingual, we can't see the metal that's on the lingual surface. So if the junction where the crown meets the tooth, you see some graying there, generally patients are okay with it. So if they're okay with a little graying, that means we can use metal, which is a much stronger material, and it allows us to reduce less tooth structure. Also, if you were to compare margins, a casted margin, where, you know, like the video showed, where we had that lost wax technique, where we wax it up, we burn it out, and then we sling metal at it, that can seal that junction pretty darn well. Okay? Whereas the porcelain junction, when we stack porcelain onto that edge, still seals it well, but generally not as good as a metal margin. Okay. So in non-critical areas, we have advantages, or non-aesthetic areas, we have advantages if we can use metal. All right. So shoulder, we want that to be flat, so meets the external axial surface at approximately a right angle. So that's a picture of a shoulder. And this is just a summary slide of the dimensions that we want. So chamfer, we want 0.5 millimeter. It's a metal. It's an obtuse angle. Shoulder, 90 degrees. We're going to use porcelain, 1.2 millimeters. So in our burrs, we have an 856 burr is on the left. And at the tip, the width of that is 1 millimeter wide. That means if we go halfway, then our chamfer will be 0.5 millimeter, which is essentially what we want. On the right, we have our KR burr. So 6847 is the number. And that's 1.2 millimeters in diameter at the tip. So if we just take it to the full width of that burr, then we know we're in good shape. So we'll look at in your manual, we have a little burr kind of kit that we put together. So we'll go over some of those dimensions. But think of those burrs as sort of, it's also another tool or instrument that you have to make measurements. Remember in operative, we always, at least I did, I always asked you to grab out or pull out your chisel and your hatchet. and then run those through your boxes and kind of help you gauge measurements. So remember I said before, part of D2 year is learning or calibrating what your eyes see to what is reality. So if these are known dimensions, then we can start as we prep, kind of have a visual aid in terms of kind of figuring out, oh, have I reduced enough? Is it about the width of that KR burr? And then you have that in your memory bank. So it's just another instrument that we have to kind of constantly be checking our measurements. Okay. All right, so we went over this chamfer versus shoulder. So chamfer is more conservative. You can see that we just have a little less tooth structure removed at the margin. So technically, chamfer is more conservative, but it's very little tooth structure we're comparing. But it is stronger, can be used in non-aesthetic areas, and marginal seal is better with the metal. All right. So here's another comparison. So which pen is easier to draw a curve of uniform thickness with? Something that's a ballpoint pen or like a dry erase marker? What do you guys think? So imagine drawing a C with a dry erase marker. How hard is it to get a uniform thickness? It's a little harder, right? Because as you get to that curve, and then it's like narrows out, and then you got to turn, and it's like, right? Whereas a ballpoint pen, right, you just draw a C, and then you're okay. So the idea is that a chamfer is generally easier to prep with. A shoulder, you can end up with some of these stair steps as you kind of turn corners and kind of follow the curvature of the tooth. So when we can use chamfers, it is a little easier to prep. All right, so shoulder. So whenever we use porcelain, it's important that we have a flat surface. So the important point here is porcelain is strongest when it's under compression. So thus, porcelain should rest on a flat surface. So this idea of compression versus tension will also come into play when we talk about metals and stacking porcelain. This will be maybe a week or two from now as we answer the question, well, how do we actually get porcelain to stick onto this metal? Right? So Michael brought the point of this fusion, porcelain fused to metal. So this idea of metal versus porcelain and the coefficient of thermal expansion will come into play. Remember, we got to put this porcelain into an oven that heats up, and when things heat up, what happens dimensionally? Shrinks, expands, right? So things expand and they'll contract, expand and contract. And porcelain is great under compression, but you put in a little tension and it'll fracture, right? So, all right, where should the margin end? And we'll just list three things here. We'll get in more of it tomorrow. But supragingival, equigingival, subgingival. So above the gum line, at the gum line, below the gum line. So what are some advantages of keeping it above the gum line? Well, it's easier to see. It's easier to check if you're sealed. The disadvantage is, well, you can see the transition between the tooth and the crown if the color is not matched perfectly. So you can take those principles and apply it to the others, equi versus sub. We'll dive into that a little bit more tomorrow. All right. So some key terms that we'll need to know for the lecture, or also for your exams, but retention form. So what is retention form? So it's the quality inherent in the dental prosthesis acting to resist the force of dislodgement parallel to the path of placement. So really it's how hard is it to pull the crown straight off of the tooth. That's what we mean by retention. Okay, so along or parallel to the path of placement. And this will be contrasted by resistance form. So before we get too far, let's jump into it. What is resistance form? So the feature of a tooth preparation that enhances stability of a restoration and resists dislodgement along an axis other than the path of placement. So if you were to take your finger and if you were to push on a crown, right, let's say it's sitting on your stone cast, before we cement in, you just want to test the resistance form. Take your finger and just push and see if it'll roll off. So if it doesn't roll off, that means you have good or adequate resistance form where just the natural contours of the tooth prevent that crown from rotating off. Whereas if you push and it easily rolls over, then you're lacking some sort of resistance form. Okay? Because the stability, it doesn't resist dislodgement. Okay, so it's both describe resisting this dislodging force, but retention is along or parallel the path of placement. Resistance is on an axis other than the path of placement. Hopefully, pretty simple to understand. Just diagrammatically, you can see the axis of rotation. If I were to take my finger, and if I were to push this way, part of this crown is going to hit this wall here in this region, and that's going to prevent the crown from actually tipping over. Okay. So what are factors that influence retention and resistance form? So to simplify this concept, we're going to talk about total occlusal convergence. So the angle measured between opposing axial walls when a tooth or teeth are prepared for crowns or fixed dental prosthesis. So I'll jump back to this example, but just very simply, I think you guys get this idea. Okay, you ever pick up these red Solo cups at parties you guys throw, right? How often do they stick to each other? Sometimes you'll pull and you'll have multiple cups, right? And why is that? Well, their walls are fairly parallel to each other. Whereas at these same parties, I'm sure you guys all throw on these party hats, right? You pick one of those up. How many times do those stick together? Not very often, right? And why is that? Because of our total occlusal convergence. One is parallel, the other is more tapered, as we call it. Okay. So parallel, taper. So next time you guys are playing beer pong, I know retention resistance form will come to your mind. It'll be the talk of the party. Okay. All right. So that's the concept, right? So resistance or retention form is influenced by how parallel your walls are. So let's back it up here. If we got a prep here, and let's say these lines here indicate our path of placement, so what orientation this crown is going to be seated in. And then if we were to draw another line along the, or to see how much this wall is tapered, then we get a measurement. So you get two lines, you measure the angle in between them. Well, we do that for both sides. So you can do it mesial and distal. And if you're looking the other way, you could also get a buccolingual measurement too. You add those two angles together, and then you get a total convergence measurement. So as your total convergence gets bigger, so let's say we ran a test, right? Let's say you had 1 degree total occlusal convergence, and you put a crown on, and then you tested how hard it was to lift that off. Then you increase it to 2 degrees, then 3, then 4, and then up to, let's say, 30, right? So for every degree that you increase it, and if we were to compare the retentive values, do you think that's a linear relationship or a nonlinear relationship? Exponential? Right. Anybody else? Linear? Why wouldn't it be linear? I don't know, there's too much physics in that, so let's just show you the chart. Okay. So we can see here, this is a chart of total occlusal convergence, or in this case, this is labeled taper, in retentive values in megapascals. So we can see it's a non-linear relationship. So as you get to some point where, okay, your retentive measurement just kind of drops pretty precipitously. All right, so the next slide is how does height to base ratio affect resistance form? So is it better to have a greater height to base ratio, meaning we have real tall, like let's keep the base the same, and then we have a tall prep versus a short prep? Or let's think about this, so let's keep the height the same. Would you rather have a wider prep or a more narrow prep to aid in resistance form? What do you guys think? Wider. Who said wider? Okay. And why is wider better? Okay, so distribution of force is a different kind of concept than when we're talking about resistance. Because remember, resistance form is resisting kind of tipping forces. So when I think of distribution of force in the occlusal table, like we talked about in mutually protected occlusion, you're right. When we load the tooth, it kind of spreads the forces out. But how does that affect our tipping force? Oscar, you mentioned wider is better as well. We get more retention. Okay, what's retention? Retention is along the path of placement, right? So how does that fit together? Back row, anybody in the back row have any ideas? Taller the better, wider the better? More surface area. Okay, so increased surface area would lead to more frictional resistance to each other. Right? So in theory, if you made something real wavy, you would have pretty decent retention and potentially resistant forces. Right? So the idea is that the higher the height to base ratio, the increased resistance form we have. So the way to think about it is just, let's see if there's a good slide here. Yeah. So if you start down here, maybe I'll stand in the front so everybody can see. So again, our axis of rotation is going to start at one end of the crown margin, and we're going to try to tip the crown, right, laterally. So we're pushing here, and this will try to tip. Okay. So if you have a tall prep, think about when that crown gets to number 3 or 2, right? The edge of that crown is going to hit the tooth, and the tooth itself is going to prevent that crown from going any further. So that's where increased height helps, because the taller you are, then eventually it hits the tooth, and it'll prevent that tipping force. And again, the total occlusal convergence has an effect on our resistance form as well. So the more parallel you are, the greater the chance that you're going to hit that tooth as you rotate. Whereas you can see something that's like a TP, eventually that never touches the tooth. So what I think the point here is the taller your prep is, the better your resistance form. Okay. And also, the more narrow your prep is, the better your resistance form. And narrow is better than wide. So let's take two preps of equal height. One is this big. One is this big. Right? So I'm going to rotate something that's this big off. Think about the arc that he needs to take for it to be dislodged versus something that's real narrow, and then that arc is a lot more sharp, or more steep. So if your arc is more steep, it's going to run into that tooth a lot more quickly versus you have something wide, and then it'll clear the tooth. So height to base ratio affects resistance form. So the taller, the better. Narrower, the more resistance it is. So if you think about our teeth, which have wider bases? A molar or a lateral incisor? A molar. So are you going to have an easier time with a molar or an incisor in obtaining resistance form of a prep? Incisor, right? Because the base for a molar is a lot wider. That means the arc in which it tips may allow you to. So basically, that's this example here, where this never runs into the tooth. It doesn't have a natural resistance form because of the width of that. Whereas if this line here was a little shorter, then the arc in which that flows is a little steeper and it'll run here. Right? Everybody get with that concept? Okay. We'll let that sink in just for a little bit. So what if you place a groove in a preparation? How does that help? So this isn't sort of a reduction or a depth cut that we're talking about when we start prepping, but just after your prep's done, you take a burr and you sink it into a wall a little bit, right? And then you make a crown where there's a little bump in the inside of the crown that fits into that slot. Well, effectively what it does is when you place a groove into a preparation is it effectively decreases your base. Remember, it's a height to base ratio, right? So before, our base was this distance, so we'll call that x. So by placing a groove there, now this is x divided by 4. Let's say it's a fourth of the width that it used to be, right? So then when we go to rotate and tip and push it that way, the arc in which it takes will run into this wall of that groove and prevent resistance or rotation of that tooth off of rotation prevents the crown from rotating off of the tooth. Okay. So grooves help because it essentially effectively decreases that base measurement, which thus increases your height to base ratio. Okay. So that grooves help in resistance form. Okay, path of placement. So basically what this means is what direction are you going to put the crown onto the tooth in? So most of the time in our typodont, pretty much all of D2, everything is ideal, right? All the teeth are straight up and down. So the path of placement is going to follow the long axis of the tooth most of the time. So one of the things that you want to do and kind of get good at is kind of train your eye to be able to see down this path of placement. And obviously the scenario on the left we can't always do because there's certain angles that we can't see through, like patient's lip to look at that. Or it's a maxillary tooth where you can't use direct vision to sight down exactly the path of placement. So one of the skills you guys have to develop is learning how to angle your mirror and position yourself in such a way that as you sight down and then the mirror reflects what it's seeing, that you're looking straight down on the tooth along its path of its insertion. And in our case, it's always going to be along the path of the long axis. So just think of it like a drone. You're looking straight down at a mountain. You want to be right centered over the mountain and look straight down at it. Okay. So you want to practice visualizing things in the path of placement. So this is important to do because we're going to talk about this idea of an undercut. So you can see the path of placement on the left and then the path of placement on the right. So you can see the path on the right tips a bit to the right, or mesially leans a little bit. And in this scenario, the crown is then able to seat because due to the path of placement that the crown has to go into, it's going to run into or bump into that neighboring tooth. So you can see how the prep, if it's not along the path of placement and you're a little bit off kilter, then that can affect our crown fabrication and crown seating, right? So we're going to call the part that's here, we call that an undercut. So let's dive into that a little bit. And any irregularity in the wall of a prepared tooth that prevents the withdrawal or seating of a wax pattern or casting. So let me try to simplify this concept for you guys. So let's say we had our cup, right? And we've accidentally put a little dent into it. So it looks like this. Okay. So remember the two cups before, they can draw. We were able to take them apart. Okay. But if there's a little dent, and then we put a second cup in, and then have that second cup adapt to the same shape as the bottom cup, are we able to pull these two apart? No, because the top cup has engaged that undercut and it's locked in, right? And there's no path of placement, or let's kind of turn this or rename it. It's also known as the path of withdrawal, right? So a path that it goes in and also the path that it comes out. So there's no path of withdrawal because the cup runs into the other cup and it kind of locks it in. Okay? So in this situation, we also have an undercut that would prevent us from lifting that out. So remember one of the steps that we have in fabricating a crown, right? Let's say we've mounted it all together. What's the step after we mount? Wax up, right? We got to add wax to this die or this prepared tooth. So a die is D-I-E is another name for that stone thing that looks like a prep, right? So remember from the video, what was the first steps after we paint the die spacer and lubricate the die? What did the lab technician do? They turned it over and dunked it in some wax, right? So now the wax, think of wax as your second layer of your cup. So your initial first cup has this feature. It's got a little divot. Then my second layer is wax. It covers it evenly, but it also picks up that same feature. Now, eventually, we got to take this wax pattern off and invest it and then cast it, right? Remember that whole workflow? So what happens when you try to take the wax off? Either you don't or it breaks, right? Because wax is an inelastic material. It doesn't rebound to where it first started from. Okay? So it's either going to break or you just won't be able to do it. So that's not good, right? How are we ever going to cast something that's broken? So one of the ways around this, let's say this is an actual tooth and you have this little divot. Well, what if you just put some composite in there and fill that space and then made your impression? So we call this part blocking out the undercut. Okay. So we want to minimize undercuts. And remember from your CEREC, at some point, I asked you to define the insertion axis. And on the little sheet, we asked you to minimize the amount of yellow that's there. So the yellow lets you know if your tooth has an undercut somewhere. Okay. So another way to identify an undercut is, let's say you're looking straight down on the tooth. Right? So pretend you're a drone looking straight down at a mountain. Okay. And let's say you stick your explorer tip all around, and you circle around the margin, right? Everywhere you go, you should be able to see the tip of the explorer, right? And let's say you go up on the tooth a little bit, and let's say the tip of your explorer sinks in here a bit, right? Are you going to see the very tip of your explorer? No, it's going to be hidden, right? So one of the things we want you to do, too, as you're evaluating your prep to see if you have an undercut is practice with the mirror, figure out where your path of withdrawal or placement is. So you're sighting straight down on that tooth prep. Take your explorer and then run that explorer tip circumferentially around the tooth. And if you ever see that tip disappear, then you probably have an undercut. Okay. So in order to correct this situation, so this is our undercut here. So we want to change our path of placement. Let's say our path of placement, we want it to be this way. So if we draw a line straight down that mimics the path of placement, we'll see all this area here needs to be blocked out, similarly to that divot. Unfortunately, if we block it out, well, the crown is going to be too wide. It's going to go beyond our margin. Okay. So I don't know if you guys can visualize that, but as you see the crown, well, it's got to be at least this wide with some thickness or material. It's going to sit here. The edge of that crown or the margin is going to sit beyond where we had tooth. So tooth ends here. Crown's going to end out here. So that's not good because you're going to have a ledge when you seat that crown. So in order to fix it, we need to go back and grind this part off so that we've eliminated that undercut. So now when you look down along that path of placement, you have what we call a draw, or you have a path of withdrawal. So oftentimes you'll hear, did you check for draw? Are you able to draw that wax pattern off? Are you able to draw that provisional material off? We don't want things to get locked in. Okay, so here's just another example. This is our path of withdrawal replacement. We can see here there's a little bit of an undercut. So if you're looking straight down here, and then you have your explorer tip and you run it around circumferentially, is that explorer tip going to disappear there? Yeah. So that's how you know if you have an undercut. Or that's one way in which you can analyze your prep to see if you have an undercut. And undercuts are bad because it inhibits sort of our fabrication process. So the fact that we can't take off a wax pattern means we can't make a crown. And what you also learn tomorrow when we do our temporary restorations or provisional restorations is you're going to get your temporary locked onto the tooth because there's no way for it to flex over and kind of pull it out. With impression material, we're okay, because what do we know about impression material? It's an elastic material. It can flex over, it can release, and it'll kind of go back to its place. But imagine putting something rigid in there, right? So you put something that, like composite over, and then all of a sudden it hardens, then you've got it locked in. All right, so undercuts, that ties in with path of withdrawal.